There's a lot of things that I didn't know about prescribing when I started prescribing. It's actually a little embarrassing now. I didn't know what the FDA did. I thought that if a drug was FDA approved, obviously it was safe for patients. I didn't know that there were any principles or strategies involved with prescribing. I just thought when a patient complains of something, you give them a medicine. I didn't know how insurance companies worked. I didn't know what medicines patients can pay for or not.
A lot of the principles of conservative prescribing are actually also kind of the bedrock of nursing, paying attention to patients, listening to patients, wanting to know what their preferences are, what their thoughts are. And so I take that and I use that in my own practice as well as teaching students in order to be able to make sure that they're taking into account what a patient is wanting before just saying, here's a medicine that you should take.
As a provider, what I found when I initially became into practice, I was confronted not so much with how these drugs are used and the benefits, I was confronted with the real risk associated with these medicines. Oftentimes, whether you were in the clinic or whether you were working in a healthcare system, many times these patients were coming with adverse events. And these adverse events ultimately was a challenge on how we address those as clinicians. And I felt the more informed we were as prescribers, the better we'd be able to utilize medicines for our patients for optimal outcomes. So it's up to you as a healthcare member and prescriber to be aware of these principles and understand that it's your responsibility to be educated around the safety, the benefits, and the risks of medications.